From a perspective of financial viability, I think that's the another key that moving forward into the ever-changing healthcare system as it is, I think we are going to be very well versed to look into bundled payment, value-based purchasing. From a bundled payment perspective, I think we're definitely well versed to be able to look at, again, where is a patient best suited to be within the continuum. I know a lot of organizations, a lot of healthcare organizations, hospitals are looking to partner at this point with outside organizations, whereas we have all of those pieces to the puzzle from the post-acute care section. The one thing we don't have is hospice. So we are looking to definitely partner up with some local hospice organizations to be able to provide that piece of the continuum as well. The readmissions, I think, is going to be it's going to be key for organizations to have post-acute care and various levels of post-acute care. We're really looking at right now and kind of straddling fee-for-service and knowing bundled payment is coming. We're really looking at what are some interventions that we can put into play that will help us look at readmissions. So certainly we're tracking readmissions, looking at where are our readmissions coming from, where are they entering into the system, and what can we do to support those patients and families prior to them getting hospitalized. So looking at our heart failure clinic, looking at being able to have home health do some courtesy visits that wouldn't be billable through Medicare and Medicaid, to do check-ins with patients to make sure that they're taking their medications, that they have access to their medications, which pharmacy being another huge piece to this puzzle. There are a number of individuals who, because of finances, because of availability, are not able to get their medications or choose to purchase some of their medications, not other medications, split pills, do whatever they can to attempt to manage their illness the best that they can.
On their finances.
On their finances. So being able to intervene at different levels prior to the readmission, hopefully to help support them at a different level of care that would be appropriate to keep them outside of the acute care setting. From a patient perspective, it's certainly a new twist for healthcare to look at people when they're well. I think certainly in the past all we've really focused on is when people are ill. And I think as we move forward, population health is definitely coming. And so I think looking at what are avenues that we as a healthcare organization can implement to help the population remain healthy. How do we touch them? How do we get to them when they aren't sick? Because typically that's when people look at coming to a healthcare organization. From a perspective of being in a small town, I mean, I think Kankakee is a small town, but a small town with with a wonderful healthcare organization that is really cutting edge.